Assalamu alaikum wa rahmatullahi wa barakatuhu. Adab. Welcome to Sheikh Official, which is a virtual platform for the young writers of the Valley and not Valley, also the outside Valley, for the people outside the Valley. Though Sheikh not only works with the writers of the time, we also work together with the youth of the time to talk about the burning topics of the time, like drug addiction and other topics. And today here we're also joined together to talk about the one of the burning topics of the time, that's the post-COVID precautions. I, Sheikh Mahiruqh, along with my co-host Bintul, will talk to our panel of guests here. So I'd like to Bintul Islam to introduce the panel of guests. Thank you.
I welcome all the guests to this virtual panel discussion. So today we have on board Dr. Shahnawaz, who is a medical doctor, a researcher, and an author. He's an interventional radiologist at Max Hospital, New Delhi, and has performed more than 2,500 procedures successfully. Welcome, sir. Then we have on board Isha Malik, who is a clinical psychologist with a specialization in EMDR and currently working at GB Pant Hospital. Welcome, ma'am. A heartily welcome to all of you for being here with us today. And without further delaying, so I would like to ask Dr. Shahnawaz, so you a question that when can we say that a COVID-19 patient is cured and can resume normal life?
Assalamu alaikum, everybody. See, I mean, majority of the patients, the COVID patients usually recover on their own, majority of them, and very few of them require hospitalization. So once they say after 10 days or a maximum of 2 weeks is required for a patient to be biologically negative for virus, though he may continue to test for the virus, but usually 10 days or 2 weeks should be the optimum time for isolation. Since many patients don't develop very severe symptoms and most of them are isolated for the reasons because of the positivity. So 10 days or a maximum 14 days should be the ample time for a person to resume or mix with the people and resume his work. And for patients who have got severe symptoms, who got hospitalized, obviously they will have to wait till they get discharged from the hospital and they regain the energy and their potential to resume the work, but not less than 10 or 14 days for any of the patients. But for those patients who are hospitalized, they need to wait till they get discharged and their symptoms are over.
Okay, thank you, sir. So, ma'am, I would like to ask you a question that people are facing taunts and social discrimination at every stage of this COVID-19. So, how do you see that this social stigma arising out of misinformation is a hindrance in battling with this battle?
Basically, many COVID recovered patients or people who have been diagnosed with the COVID infection, they are facing a lot of stigma. मतलब जैसे like people they have like reported कि घर आने के बाद the neighbors who live next door or people in the area that they live in, मतलब पूरा जो एरिया है एक फॉर एग्जांपल जैसे यहाँ पे होती है ना हमारी गलियां या लेन्स, तो क्योंकि वो खबर पूरी जगह फैल चुकी होती है, सो उनको उस नजर से देखा जाता है एज इफ देयर समबडी हु इज अनटचेबल एंड कंप्लीटली काइंड ऑफ वो सोशल डिस्टेंसिंग तो है ही, बट वो एक होता है ना फिर एक वो रिस्पॉन्स जिससे लगता है इंसान को, मतलब सपोर्ट काइंड ऑफ वो नहीं उनको मिल पाता है आसपास के लोगों से। मतलब वो काफी मैंने देखा कि उनको उनके साथ बात करना, उनके साथ मिलना जुलना काफी अवॉइड करते हैं, मतलब तो इससे काफी इफेक्ट पड़ता है उनकी मेंटल हेल्थ पे, बिकॉज ऑलरेडी वो ये जो है मतलब स्पेशली जिनके सीवियर सिम्टम्स है या जिनको हॉस्पिटलाइज करने की जरूरत पड़ी थी जिन पेशेंट्स को, तो ऑलरेडी उनके लिए एक ट्रॉमेटिक इवेंट था। एंड घर आने के बाद जब वो इस तरीके का बिहेवियर देखते हैं अपने आसपास, तो उससे ज्यादा उनके मतलब जहन पे, उनके मेंटल हेल्थ पे असर पड़ता है, बिकॉज एक तो वो अपना ही स्ट्रगल कर रहे होते हैं लाइक टू कोप अप, टू रिकवर प्रॉपरली एंड टू like try to forget this traumatic experience, and this kind of behavior actually makes it more difficult.
Yes, ma'am. Okay, thank you, ma'am. Is
Thank
for some patients, recovering from COVID-19 has led to a slew of mental health issues, ranging from sleeplessness to anxiety and panic attacks. So, how would you consider this?
Yeah, true. It must have happened to many people. See, there is a lot of social stigma and scare associated with this disease. Though there are deadlier diseases we live with and we see in our daily lives, we have patients seen. But somehow, because this disease is in the public eye and there is a pandemic going on, the patients are more scared. But at the same time, family support from the friends, and support from the healthcare workers can help people to overcome the anxiety out of this. And those patients who have already recovered, they don't need to worry about anything. Many patients keep on texting me or asking questions like, are they next going to develop black fungus? Some patients ask that they had done X-rays n number of times during the disease, or they had to undergo a CT scan. Oh, so are they going to develop cancer next? So there are things which have like come into the minds of the people who suffered from this disease. But I can tell you with assurance that majority of the people, 99.99% who people who recovered from this disease, don't need to worry about. The people who suffered cytokine storm during the disease, only those people are the people who might need, not all of them, but some of them might need to get certain blood tests after recovery, till their all the blood tests get normalized, till their D-dimer levels, inflammatory markers are normalized. Until then, their doctor will advise them to take whatever medicine they ask them for. For majority of the patients, other than those who had cytokine storm, they don't need to bother about it after they are recovered. The only thing they need to do is to take a vaccine, maybe 1 to 3 months after recovery.
Okay, thank you. Okay. Ma'am, as we all know that children are impacted all the same, and when it comes to the more intangible consequences of the pandemic, it's more of a problem not for the children, but for the parents who go outside and have to earn for their children. So, to what extent this financial issue affects in pre and post COVID stages?
The financial crunch and the financial difficulties, it has been a major stressor during the pandemic, because many people, they've lost their jobs, or people who have small businesses or independent businesses of their own, they have been affected a lot. Like many people have lost their jobs, and they are being forced to do some jobs which like don't actually match their profile, are very low below that profile. But since there's no other option they have, so because of that there's a lot of stress, and there's a lot of anxiety in people as well, because it's so unpredictable. Like we can't predict कि कब खत्म होगा, when will this pandemic end, and how long do those people have to continue to struggle with with these financial difficulties. And then the children as well, they're also affected, because they're at such a young age, they're not able to process and understand these things, these kinds of difficulties. So they keep on asking their parents for different things, because even the parents are not able to explain this thing to them, that we won't be able to afford such things, like we used to get toys and all for you and different kinds of things, but right now we have to restrict our expenses. So it's quite difficult to explain your children the same. And the children, they're also feeling very stressed, because since like especially in Kashmir, since 2019 they haven't been able to go to school. And apart from that, they're just restricted in the four walls of their house. There's no social interaction, there's no play activities with their peer groups. So there's a lot of psychological impact on both the parents, and the financial difficulties are adding upon the stress.
Okay, so my next question is to you. I just want to ask that after recovery of COVID-19, many of the patients have some complications. They have complained of some complications like anxiety, and some complain of headaches, and some complain of fatigue. Why is this common every of the patient after recovery from COVID-19, or is this a stigma and social anxiety? Is this anxiety in their mind because they have came out of a disease which is not so easy? So is this in their mind, or is this something a medical complication? Is this normal with every person that they have a complication after recovery from COVID-19?
Yeah, certain things after COVID are true, and it is not just in mind. Like we now know that there is a term called as long COVID, and there are people who continue to suffer even after recovery in terms of the lack of energy, or they might have easy breathlessness on walking or running. So long COVID is something like which can affect a person. But having said that, we know that majority of the patients who recover from the COVID should be doing well, and because there is a lot of anxiety associated with it, so anxiety cannot be entirely ruled out. So the first thing we should come to the mind should be that the patient must be having some anxiety or might need some psychological support. But if that doesn't help, then we must explore the other options like long COVID or COVID sequelae. We are still not sure like how long time it will take for a person to completely recover from the long-term effects of the COVID, those who suffer from such conditions. But for majority of the people, because this is a public domain we are speaking right now, the COVID recovers within 10 days or a 2 weeks time, and after that they should have no complications, there should be no symptoms, and they should be able to resume their work, resume their offices, and there is nothing to fear actually after that period of time. And those who have taken steroids or who have concurrent diabetes, they are also safe once they are recovered. The only precaution they need to regulate their sugars properly and check them properly. Thanks, I'm done talking.
Thank you, sir. Over to Isha, ma'am. Ma'am, what are the precautions that the patients and the family members need to take after recovery from COVID-19?
Precautions like general precautions, what do you mean?
Recovering from COVID-19.
Okay, so I'll talk from a psychological perspective. Like many people, uh, like the pandemic has had an impact on everybody. Like all of us have been impacted by it, but our reaction towards it has been different. Like everybody has a unique reaction, and those people have been impacted more who have who had the infection, or who lost a family member, or a family member was severely affected and had to be hospitalized for a long period of time. So those people have it's a bit more difficult for them to actually recover, like physically as well as emotionally, from COVID-19. So it's a bit of a task for them. So the precautions I would suggest is that to take care of your emotional, your your mental health specifically, because it's important to be emotionally stable in order to in order to problem solve different things which are difficulties that you're facing, or in order to um, recover physically as well, you need to be emotionally and psychologically stable. So better to dedicate some time for self care, for physical exercise, and try to reach out to people. Like you can talk to your friends and family. So look out for that support, for that help, and try to keep yourself as busy as possible. Not physically, maybe they might feel fatigued and all, but they can do different things like socially connecting with people virtually, or doing different things which might interest them, or indulging themselves in new hobbies, new interests, maybe reading some novel, watching some like inspiring documentaries, or any new art and craft activity, and different things. And if they feel if they feel that there is a difficulty in sleeping, or the eating pattern has changed, or there are symptoms of panic attacks, or they are having flashbacks of the traumatic experience, or different kinds of psychological problems if they're facing, and they're not able to cope up, so in that condition they should reach out and seek help from some professional. Because I've also observed, and many clients like reached out to me, so they had difficulty, like before COVID they were quite fine, even if they had any psychological problem it was manageable. But post COVID they started having difficulties in sleeping. Many people started having panic attacks and a lot of anxiety, breathlessness, and all, and negative thoughts. For example, what if I die? What if my parent dies? What if my son or daughter dies? Or what if I'll never be okay? Or what if the pandemic never ends? Will I get a job or not? So different kinds of negative thoughts. So for that, you'll need professional help if it's not manageable, like if you can't cope up with the situation. So they should the family members should also observe and see if there's any change in the behavior of the person who has been infected by COVID after recovery. Maybe physically he'll be fine, but internally maybe he's not still stable. So they can try and talk to them about it and ask them how are they feeling. Are they fine? Are they getting enough sleep? Do they feel hungry? Are they feeling fatigued? And different kinds of questions, just to make sure that they're okay and being able to cope with the situation.
Okay, thank you, ma'am.
I'd like to ask a question that what do you think the rigidness in the society of Kashmiri people, or the lack of the like infrastructure, the health infrastructure in the valley? What do you think? What has caused the more problem to the doctor fraternity? The rigidness in the minds of the people regarding the COVID-19, or the lack of infrastructure in the when this health this faculty? What caused more problems?
Thank you for that. Thankfully, till now, we didn't see any major outbreak of the COVID in Valley like we had in Delhi or we had in Bombay, which collapsed the system altogether. So whatever we saw in the Valley is a moderate wave of COVID infections, thankfully. But the question you asked, like what has troubled us more, I can't say anything about that. We don't have any clear-cut data to back any of the claims. But I must tell you that there is lot of work which needs to be done in regard to the infrastructure in Valley. There is some degree of infrastructure in place in both government as well as private sector, but a lot of work needs to be done in regard to the infrastructure, both in the public as well as the private domains. Especially, I would like to say that health infrastructure in peripheries, in districts and towns and smaller places, villages and other places, they need a lot. Like we have any disease, uh, be it COVID or otherwise, for any disease, patients from far-flung areas, from villages have to rush to SMHS hospital or skin Sora. So this should be not the case in our planning. The health planning should be such that in next 5 years or in next 8 years or next 10 years, we should have a system in place where the patients, or not all patients need to go to skin Sora, and we should be able to cater to majority of the population within their own districts. This should be the goal in next 5 years. Like we should have teaching hospitals in all the districts. We should have good infrastructure in all the districts. because healthcare is not complete unless it is available at your doorstep. If it is so far away that you can't reach there, then it doesn't make any sense. There has been a concern from the other part of your question is like from people, there are misconceptions and there is a mistrust. I can say people don't trust the administration easily, but there have been reasons for that and we cannot negate it completely. So I don't think that should be a major concern once seeing the globally what happened with the people and their misconceptions. I think we have been doing pretty okay, if not very good. We have been doing average. It hasn't been bad. Thank you.
Okay, thank you, sir. So now, due to the time limit, we have to conclude this session. I would pay my sincere gratitude to all the panelists for being here and contributing their valuable suggestions and ideas with us. I would also thank my viewers and the listeners there and for being a special support system throughout. I would thank my co-host and the whole team of SharePoint Official for their effortless contribution. And with this, Mahiruqh and I am signing off and with a message that stay safe and wear masks and keep sanitizing. Thank you and take care. Khuda Hafiz.
Thank you very much. Thank you all.